Hi, this is the Skills Lab number 1, Asepsis, Personal Protective Equipment and Safety, and this is a PowerPoint overview. The lab prep for lab number 1 consists of our Blackboard work, which you have viewed. We need to review the PowerPoint and the student handout, which is all on Blackboard. The skills video, the Mosby sign-in, you can actually click here to sign in if you'd like to get to the videos. The videos that you need to watch for this lab are performing hand hygiene and using personal protective equipment and isolation precautions. Once you have viewed the videos and associated materials, you can then complete the online test, and that test will automatically record in Mosby's, and I'll be able to see that you've done it. There are readings that you will find delineated in the student handout, and then at the end of this lab we will be doing a simulation in the lab. All of our skills are based on QSIN, and QSIN is means quality and safety education for nurses, student nurses, nurses in practice. And what we need to do is our goal is to prepare you, the nursing students, with the knowledge and skills and attitudes for correct patient care, teamwork, collaboration, evidence-based practice, quality improvement, safety, and informatics. It's a lot of information, but highlighted here are the two that I think are most important, and at least in this lab, is evidence-based practice. Why we do what we do. We don't do it just because. There's science behind it. And then also safety. This whole lab is focused on patient safety, but also your safety. So the QSIN definition of safety means minimizing the risk of harm to patients and providers. That means you, through both system effectiveness, do you have the tools to do the work that you need to do, and your individual performance. And that's what the lab is to increase your knowledge and performance of those skills that will keep you saved. Now, when we talk about aseptic technique, there's two types: medical asepsis, which is clean, and that basically is our hand washing, and there's surgical asepsis, which is sterile. The difference is, medical asepsis, we want to prevent the spread. With surgical asepsis, our goal is to eliminate the microorganisms, and that's the difference. And what we'll be focusing on for this lab is medical asepsis clean technique. I want you to take a minute now, and you can do this at your leisure. I want you to think of 3 words that you associate with patient safety. And just take a second. You can pause this PowerPoint or whatever and write those down. We will discuss them in class. And after you've done that, I want you to watch the following videos on the next 2 slides. I will peruse over them, but I want you to stop and watch them. So you have written down those words. After you've done that, I want you to watch this video, 3 words, keeping patients safe. What this video is about is a hospital's commitment to you and the patients in keeping both of you and everyone safe. And you will see that it is not just the nurse, it is a team, and it's a team of every member that works in an institution, and also the patient is very definitely part of that team. All you need to do is click on this lower link, and it'll take you right to it. It's a 7-minute video, and it's an excellent overview of elements of patient safety. The next video I'd like you to watch, this one's about 6 minutes, and this is a shocking preventable patient event. And it's put out by the Department of Health and Human Services. I do want you to watch this video. It is a video that shouldn't have happened, and this was actually a real episode that they have since made the video about. There's more to it, but all you have to do is actually watch the initial video, and I think that we will certainly discuss this in class. So, a thought to ponder. Approximately 1 out of 20 hospitalized patients will contract a hospital-associated infection. And that's a little scary, 1 out of 20. The overall annual direct medical costs of these hospital-acquired infections can be up to $33 billion. That's a lot of money, and that's a lot of our money. And you can see that I've got the references there for that. And I just want to kind of set the table for what it is that you'll be working in. So remember, after you've watched the videos and that sort of thing, what I want you to remember is that on a dry surface, microorganisms move slowly. On a wet surface, they move and multiply quickly. That's why we turn off the faucets with a piece of paper towel. That's why we don't want our uniforms wet, because that's when those microorganisms will move fast. So make sure you always dry your hands. Dry your hands thoroughly, keep your uniform dry, and make sure you dry your patients thoroughly when you're providing personal care. And a couple of key points to remember as far as personal hygiene and that sort of thing is when you present yourself in a clinical setting, make sure that your hair is restrained. You do not want any hair falling into your face, into the area you're working. It is not a good habit to have. Keep your nails short. We can't have acrylic nails or chip polish. You need to go by your agency, but underneath that is where you harbor microorganisms. Don't need a lot of jewelry, and that you need to keep to a minimum. Any open wounds that you have, scratches and that sort of thing, need to be covered with occlusive dressing in a clinical setting. And certainly don't wear any perfumes or colognes. There are people that are highly allergic to that. So these are some key points that I wanted to let you know right up front that you need to follow when you're in a clinical setting. Personal protective equipment. As you can see here in this slide, we have masks, eyewear, gowns, gloves, booties, and in the old days, what is it that we used to have for personal protective equipment was a shield and spear. Well, that doesn't work anymore, folks. Our personal protective equipment is all-encompassing, and you will become very familiar with this because you will be using this a lot. And finally, remember that your practice is based on CUSIN principles of safety and evidence-based practice. We wash our hands because. We dry our hands because. We don't wear wet uniforms because. This is all evidence-based practice. When you're wearing personal protective equipment, you do this because you are preventing the spread of microorganisms. Again, that is evidence-based practice. You want to know why you do what you do. And safety in hospitals saves lives. So this completes this video for lab number 1. Thank you.